With regards to excessive blood loss, these patients are subgrouped into two, where during the acute period, depending on the presentations of patients, how sick they are, usually more often than not, they are treated with blood transfusion. Patients who are more stable and are generally quite well, we tend to correct their anemia by the various methods that I described earlier, for example, through diet, through oral medication, and through the intravenous iron formulation as well. The next thing that is very important here is to tackle the cause of the excessive loss, because if not, then the anemia part will not be sorted out. For example, if patients having a gastric ulcer disease, then an urgent intervention is required. Someone who's having bleeding hemorrhoids, then an intervention has to be done to stop the bleeding as well. If patients having excessive menstrual bleed, then it's very important that they seek advice and treatment from a gynaecologist so that we are able to tackle the losses at the same time to ensure that their anemia is corrected. Once these underlying pathologies are corrected, then we have successfully treated anemia. When it comes to anemia, which is related to bone marrow disorders, first is to identify the cause of the bone marrow disease. For example, if it's due to aplastic anemia, there are various treatments to treat the underlying aplastic anemia. Second, if it's due to myelodysplastic syndrome, there are treatments related to treating myelodysplastic syndrome as well. And if there are other conditions that could lead to anemia, for example, chronic kidney disease, we have got drugs that basically help to stimulate the bone marrow to produce more red cells to basically increase the hemoglobin in this group of patients. For example, such drugs are erythroid stimulating agents.